Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about how to best prepare ourselves for the Nclex. So if you're watching this video, you're probably studying for the Nclex, right? You're getting ready to take the Nclex. And I want to just start with like a positive thought, just a fact here. Statistically, more people pass than don't pass. Okay, so the majority of people who take it on the first try do pass. So keep that in mind, okay? Let's get into some tips. The first tip I have for you is to study using mnemonics. Because this is going to be on everything you've ever learned in school, right? It's a lot of information. So how are you going to keep that information separate without it getting all mixed up in your head? Use mnemonic devices. So little study tools, little fun little phrases, or make up stories in your head about certain things. Whatever you need to do to memorize the information and distinguish it from other information. Stay positive. That's kind of what I wanted to imply with that first comment. Most people who take it do pass the first time, so do go in with the positive attitude. Remember, the Nclex isn't real life. So even if you've been working as a CNA or you've been a nurse intern after graduation before you've taken the Nclex and you've seen some things, right? Nclex doesn't care, okay? The Nclex is not real life. You need to think about like the perfect situations, and that's what the Nclex is asking you about, okay? Don't think, oh yeah, I had a patient one time and they did this. Okay, but would the patient in the textbook do that? No. That's not Nclex, okay? So try not to draw from your own life experiences to make your decisions in this situation. Remember your ABCs. So airway, breathing, circulation when it comes to prioritizing type questions. Sometimes you'll get things where you'll get all these answers, all these choices. The nurse could do this, the nurse could do that, and then one of them will be like, call the doctor. It's probably never call the doctor, okay? Because what are you doing then, right? So we want to know what the nurse knows, what the nurse can do. So try to find the nursing intervention first. And if you go through all the choices and you realize like, no, none of this makes sense, none of this is appropriate, then the answer would be call the doctor. But think ABCs first, okay? Airway, breathing, circulation. Prioritize your care. Take a review course. There's a bunch of different options out there. There's Kaplan, there's Hearst, there's ATI. Personally, I've had students who've taken all three, and they've all say pretty much the same thing, that they're all, pretty much just as good as each other. So any of those would be great. Any of those would be good. Make what I'm calling a mega brain binder, okay? So you're gonna go and you're gonna get one of those really big 2-inch, 3-inch binders, okay? And then you're gonna gather all of your notes, not all of your notes from nursing school, but all of your most important notes from nursing school, especially the things that you might struggle with, especially the concepts you have a harder time understanding. And you're gonna put them into this mega brain binder, and you're gonna study from this binder. You're gonna review this information until you understand it. Because Nclex asks higher level questions. So these are memorizing questions, right? These are analyzing questions. These are harder questions, critical thinking questions. And so you really need to know that information. You have to have that base of knowledge before you can even begin to answer those questions correctly. So reviewing this stuff is going to be important. Do as many practice questions as possible. Statistically, I think they say 1,000 questions on average is what they recommend you do before you sit for the exam. And I know that sounds kind of overwhelming, 1,000 questions, but you should break that up. So if you're going to take the Nclex in 2 months, okay, let's say we're going to take it in 2 months, that's our date. We have 1,000 questions. We're going to divide that by 60, because 60 days in 2 months. And then however many questions per day, that's what we're going to do. We're going to make it a little bit more manageable to try to get that 1,000 questions in. Study by body system. And I think this is honestly the best thing to do. there were some people who would say like, oh, study by like course. Like today we're going to study med surg. Tomorrow we're going to study pediatrics. And I think that's going to be a lot. I think that's going to be very overwhelming. So what I recommend is studying by body system. So today we're going to focus on congenital heart diseases, okay? Tomorrow we're going to focus on endocrine system, that kind of stuff. So every day you study a different body system. And it could be for a child, an adult, a baby, the elderly, whatever, but focus on the body system and not your like individual classes that you took. And don't cram for it. Now, I don't know many people who would do this, like in school, studying the night before the test. I think in nursing school you realize very quickly that that's not possible. You can't do that and succeed. But the idea of, even a week before, okay, I'm going to take the Nclex in a week. Today is the day I'm going to start studying. No, you should have been studying for at least a month. How are you going to get those 1,000 questions in, right? Those 1,000 practice questions in. So do not try or attempt to cram for the Nclex because that is not going to work out well for you. Now let's talk about some more tips. You want to make yourself a study schedule and you want to hold yourself accountable and stick to that schedule. So let's say, for example, you have a review book and you are going to read 1,000 pages. It's a 1,000-page review book. How are you going to do that if you're going to take the Nclex in 45 days? You're going to break it up. You're going to read approximately 22 pages a day so that you can finish this review book. And that goes for anything you're doing. If you're doing a review book, if you're doing practice questions, if you're doing practice tests, if you're just studying your notes, whatever you're doing, make sure you set a time every single day to do it, okay? Don't just be like, well, I'm going to study on Mondays and Fridays. You should pretty much study a little bit every single day. And maybe on days that you're more, you have off or you're more free time, you can study longer, okay? But you should study a little bit every single day. That being said, you do want to take breaks. You don't want to be one of those people that studies for 8 to 12 hours in one day, okay? That's not healthy for your brain. You're not going to remember all of that information. So it's very important that when you do study, you do remember to take breaks. Remove distractions. So if you're studying at home, you want to put your phone away, turn the TV off, and try to minimize, like other people bothering you. You have set aside this certain time for studying, right? It's in your study schedule, and you don't want other things interfering with your attention right now, okay? You want to focus on what you're focusing on for the Nclex. Take practice tests and see where you are struggling. This is going to be kind of huge, especially like when I talked about before that mega brain binder, how to make it. You want to take some practice tests. And you're going to see the areas where you feel like, oh yeah, I'm really strong in this area, I really understand this. And then you're going to see the areas where you're like, oh, I did not get that. I'm weak or I don't really understand it. And that's the stuff you're going to want to put in your binder, and that's the stuff you're going to want to focus on studying. So focus on the things you don't know or don't yet understand. And the stuff you already understand, you can review it, but you know it, right? So you should feel confident in being able to answer those kinds of questions. Be honest with yourself. So when taking these practice tests, you want to be honest with yourself. So if you get the wrong answer or you get the right answer because you just remembered it from before, but you don't actually understand why it's the right answer, that's not good, okay? So don't read through it and go, yeah, it's fine, I get it, it's fine, if you don't actually get it. So these two kind of go hand in hand. Be honest with yourself and read and understand the rationales, okay? So understand why the answer is the correct answer when you are doing these practice tests. That's going to be huge, okay? So on the Nclex, you're not going to get the same exact questions, right, that you got in the book. So it's not like, oh, that looks familiar, so I know the answer. You really have to understand what it's asking, the concept of what's going on, and then that involves reading those rationales when you do the practice test. And the last thing I wanted to talk about are some resources that you can use. I also wanted to list some resources. This is not all of them. There are so many these days, but these are ones I've heard good things about, so that's why I'm recommending them to you. So websites and apps, we have UWorld, We have Mark Klemick, sorry if I pronounced that wrong, but I've heard good things about him. We have ATI for review, and then there's lots of apps you can download. Some of them are free, some of them do cost money. So that's the Nclex RN Mastery, the Saunders and the Lippincott Q&As, and then the Hesse Nclex RN Exam Prep. So those are some things I've heard good things about from students. Of course, the ultimate website you want to check out is the NCSBN website, because that's going to tell you everything you need to know about the Nclex. It will have test plans on there, it will have practice exams for you to take, and then any other frequently asked questions that you might not have thought of until the night before and you're like, oh my god, what about this? They'll probably have the answer to that on this website. So this is actually a really, really good resource that I think people forget about. Other resources include Kaplan and Hurst review books. So this is a Kaplan review book, and I think it's a pretty good book. I've gone through it. I have the LPN one as well, and I would say they're pretty decent books. So Kaplan and Hurst review books if you were to take a review course. And then finally, I say this one with a little asterisk next to it, YouTube. YouTube is a good resource. There are videos of practice questions with rationales and things like that. But just be cautious and be a critical thinker when you click on these videos and decide okay, is this actually really good? Is this a credible source or not? Because sometimes, yes, absolutely it is, and sometimes not so much, right? So YouTube is good, but just be cautious if you're going to use YouTube as a resource. So this was a requested video. Nclex prep, it's scary, it's hard, you get all nervous, that's normal. Everybody feels that way. It's a lot of pressure to take this exam. But if you are prepared, if you actually understand the material, then you are going to be successful. Remember, like I said in the beginning, most people who take it are successful. And most people who pass on the first try. My one final tip for you would be to try to schedule your exam not too far away from when you graduate. So if you graduated in May and you are able to take the test, within 2 months of that, I would highly recommend that instead of waiting until, some people wait a whole year and they take it the following year and they're not as successful. So that would be my one tip, is try not to wait too long after graduation before you sit for the exam, because that's actually going to help you pass it too. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.